Okay.
Okay. So, please.
Okay.
Yes.
So, my name is Dr. Sereng Yudun. I'm currently working in Chennai clinic branch as a Tibetan doctor. Since Tibetan medicine comes into existence since from 1961 from Himachal Pradesh, and now we have 59 branches all over India. Basically, what as a doctor, what I feel is nowadays in modern society, I think people are not having that notion that how stress really affects our uh, body as a whole. So I really need to focus on that because I think nowadays people are going through stress almost like at least 90% of the people. Whenever I see them, I try to tell them that how stress in kind of stress affects our natural health, which is deteriorating because of the everyday stress also. So there is different stress like workload stress are there, personal stress are there, different stress are there. So when people think about that, when people are becoming more stressed, naturally it affects our immune system and digestion as a whole. Because when people come for digestion issues, I normally ask them whether the stress is there, because how the stress is getting infected our digestive system. When I talk about that means um, digestion system, how it affects means when we think a lot, and when we overthinking, when we something when every time if our thinking process is every time it's active means naturally our stomach also becomes less appetite also, and naturally the reaction shows from the stomach. Even acidity also will be more, and even constipation also will be there, and gas formation will be heavy. Likewise our digestion become complicated means naturally the stress over the stomach will push the heart muscles also, and naturally it affects our whole chest as a whole. And then slowly we will feel that, oh, my blood circulation over the leg and hands are paining, and that gas, the catch over the back also, the leg also, everywhere. So it pains like everywhere. So naturally the stress is the main thing I feel, it impacts the whole system.
Can you shortly tell us about how it is to be a Tibetan doctor? What is the difference? You're working like with different techniques. It's very, very
Yes,
ancient. I mean, you have your own
yes, yes,
medicine,
yes,
your own
yes.
method. You're taking the pulse, everything like this. Can you explain a little bit short to people?
So normally what we do is when we have a headache, we immediately take headache medicines. When we have stomach issues, we immediately take stomach medicines. I think treatment should be more careful about how it comes and why it comes. That our people should always think about. Like if in case you have headache, it's not necessary that you should take immediately headache medicine. At least you can just find out what kind of diet and lifestyle you should choose, and what wrongs you have done to have this kind of issues. So to rectify that, I think you should go deep into your body and into your lifestyle, and what needs to be changed. Is it because of intake of over intake of oily food, fried stuff, that also can causes the headache also. And sometimes migraine headache can be possible. Anything can be possible. So first we need to change the lifestyle which causes these issues. So for us, the main thing is lifestyle, and diet comes first. And then secondly, if things are not working out means, then medicines we prescribe. So main thing is for us, first we need to kind of rectify what kind of what causes the problem within us. And then if in case it's because of stress means, you should work on that rather than taking the medicine first. You need to rectify. If in case it's because of stress means, at least to stress to come down, we have meditations, we have mindfulness meditation also, we have stress relief, any kind of therapies also, healing also, anything we can do. If things are not working out means, then only we can take some medicines or some healings, or anything you can do also. That part I think very important.
Yes, very nice. Can you just explain? You're taking the pulse of the patients like
Yes.
this. So actually, what is your checking and how does it work? A little bit short, yes,
So
because this is probably a very
yeah.
long science. Yes.
Yeah, pulse thing we have learned for at least, it takes a lot of kind of effort, and it takes a lot of experience in having a kind of correct pulse checking also. But if I just tell you, pulse means we need to know first the nature of body, because there are different kind of patients and we have different nature of body. Some are very heat body, some are very cold in nature, some are very balanced, and some are very kind of there are different kind of natures, so according to the lifestyle, so accordingly we give medicines, like to balance the nature first. And what kind of disease, like if you have stomach issues, we try to know whether why it is coming from. Is it from the liver part? If it is it from the stress part which is causing this problem? Everything we can check by pulse, and then we come to a conclusion that what really kind of affect your body. So I think the pulse is the main for us.
I guess also that Tibetan medicine also working with the connection because you're taking the pulse and you know immediately everything. That's actually very interesting.
Thank you.
How you're managing to do this, but there's I guess a lot of experience as well,
Yes, yes.
and connection also
Yes,
probably,
yes,
you know.
yes. Yes, so basically, when we main thing is we connect with the patient. When we check the pulse, we connect with the patient, kind of what kind of nature he is, what kind of nature she is, also what kind of lifestyle they are having, and then we check the pulse, and everything means as a whole we try to know the what kind of what kind of person he or she is, and then accordingly our medicine also differs.
Yes, of course. Well, thank you very much. It's so
Thank
nice to get to
you.
know you. This is a very short introduction.
Thank
Maybe
you.
one day we can also make some more. Thank you for
Thank
this.
you. So
Thank you.
thank you.
Thank you
It's
very
my
much.
pleasure. Yeah.
Thank
Thank
you.
you.